Okay, good morning, everyone. Today we are in our next session for Career Expo of day 2. This is the health science section. Today we have Allison Cornick with us, who comes from Advocate Aurora Healthcare. So I'm going to turn it over to Allison, and there will be opportunities for questions as well.
Great, thank you. Hi, I'm Allison. I'm a registered nurse with the Advocate Aurora Health System. And, I think nursing is such a great career with so many different avenues to explore, from acute care in the hospital to outpatient clinics, even long-term care facilities, and more than that. There's several ways that you can explore your passion. I've worked in different aspects of healthcare for about 13 years now. Started in the pharmacy. I worked as a nursing assistant or CNA while going to nursing school, and I was in the hospital setting as an operating room nurse, and I now work in the general surgery clinic. Additionally, I function as an RN first assistant in the operating room, meaning I work alongside the surgeons as they perform procedures. In my current role in the clinic, I'm responsible for things like coordinating care for patients that need surgery. So I meet the patient when they come in for a consultation. I schedule them for procedures, teach them what they need to know for before and after the surgery. Sometimes I'll see them again in the OR if I'm assisting. And then I often see them again when they come back for their post-op check. In our department, we also do a lot of small procedures in the clinic. So like a removal of a mass or a lesion. If someone comes in with an abscess or an infection that needs to be drained, we can help with that. We also do a fair amount of wound care. So on top of all that, we also spend a pretty significant amount of time on the phone. We'll answer questions, provide education. We will use our critical thinking skills to triage situations so we can direct patients to the right level of care or intervention. As far as my daily schedule goes, I'm pretty spoiled, admittedly. I typically work about 7:30 to 5, Monday through Thursday. When I was an OR nurse, it was a Monday through Friday job, and I had an on-call rotation for nights, weekends, and holidays. I did help cover some nights and weekend shifts at the hospital I was at, but I primarily worked during the day, and the hours definitely fluctuate based on where you work. Working in the clinic, being a nurse involves, a bit of desk duty, but also a lot of hands-on tasks. I will look at a patient's charts, review it for any important information for their background, and then I help let the surgeon know kind of what to expect in the procedure or the upcoming consultation. The surgeon always looks through the charts too, but it's really important that the nursing staff collects any additional information that they may not have seen. I'll usually print out some information for the surgeons. They use it during the consult. And then I also prepare extra paperwork that has some educational materials that I'll send with the patients. On the flip side, my job involves a lot of hands-on work. I'll collect vital signs for every visit. I'll run an EKG to check a patient's heart rate and rhythm before a planned surgery. In our department, it's really fun because I get to help with sterile procedures. So I will set up all the instruments and make sure that we have all of the necessary supplies. And then afterward, I will be cleaning and sterilizing all those instruments too. So that's kind of a big job. We also have a lot of opportunities to help with wound care or dressing changes. We do quite a few wound vac applications. It's probably my favorite part of doing wound care. I also have a lot of opportunities to float and help with other departments. So I help a lot in primary care or the GI departments. My favorite place to float is probably the urgent care. And then I get to practice other skills like blood draws or IV starts. So it's a lot of a mix and different thing every single day. Being a nurse, I have a lot of tasks that I have to do on my own, but I'm never completely alone. Our department really works as a team. So like if I'm falling behind, one of the other nurses will jump in and help, and it's great. It's really a common theme in nursing to have individual responsibilities, but they all contribute to that big team-based picture. As with any job, nursing does come with a few potential risks. Probably the biggest danger that we see is the possibility of injury. So it's really important to follow your proper body mechanics. You don't want to lift a patient the wrong way and hurt your back. You don't want to stand funny during surgery and then you tweak your neck muscle. You do want to wear appropriate shoes to avoid falls because there's a lot of times that we move quickly on our feet. All these small things can go a long way to prevent injury. Another danger that we see is that we sometimes encounter combative patients. I've dealt with patients who have become verbally aggressive and they'll yell or swear, or some make terribly rude comments when they're upset. Others have also shown some physical aggression. As an OR nurse, I was monitoring a patient as he came out of anesthesia, and he was very disoriented. He was confused and he grabbed onto my hand. He held on very tight, wouldn't let go of my thumb, and he twisted and twisted and twisted. I was eventually able to get him free, was evaluated, and it wasn't anything severe. I just had to wear a brace for a little while, but it was an unexpected situation, happened very quickly, and it was admittedly kind of scary. But the good news is that we have protocols in place. There's always people to help, and we try to avoid and manage these situations as best as possible. I've had a longstanding interest in the medical field, but I didn't actually decide to be a nurse right away. I took a lot of classes that eventually ended up applying to my career choice anyway. So in high school, I took as many science classes as I could, mostly because I just love science. I had biology, chemistry, AP chemistry, and they all ended up helping a lot once I started nursing school. In college, I initially started down a path towards veterinary medicine before realizing that just wasn't my passion. I focused again on science. So I took biology, anatomy and physiology, organic chemistry, which I loved, and biochemistry. Additionally, I had some human behaviors courses that really gave me some great insight. Also enrolled in some sociology classes that helped me better understand how to care for people from different cultural backgrounds, which was very important now in my current career. Once I decided to go for nursing school, I gained admission to one of the technical programs. So I started at Lakeshore Technical College in Cleveland and then transferred to Northeast Wisconsin Technical College in Green Bay after my first semester. I took nursing specific courses like pharmacology, developmental psychology, nursing fundamentals, health promotion, and health alterations. We also had quite a few classes where we learned about different nursing skills that we use in the field, and then a variety of clinicals where we were able to put those skills into practice. I was in a nursing home setting. I was on a labor and delivery unit, spent some time in a mental health facility. My final semester, I spent time in the cath lab at Bellin in Green Bay. So it was a good variety where I really got to practice those skills, and it was a great education. After receiving my associate's degree from NWTC, I took my board exam to get my registered nurse license, which is required to practice as a nurse. Working in the operating room, I chose to earn my certification in OR nursing, and I'm currently working on my certification in ambulatory nursing. Those are optional things, but always a great thing to better yourself and then, increase your education. It's great. I then went on to UW Green Bay and got my bachelor's degree while I was gaining additional experience in the field. And then I have plans to move on with my master's degree at some point, but I haven't quite decided to start that yet. I truly love that my job allows for so many different career paths. I could work in a variety of settings, in a variety of specialties, and there's so much room for growth. Getting that experience and furthering your education can really point you toward leadership opportunities or fulfillment of a nurse practitioner role if you're interested in that. Currently, I'm transitioning from my clinical nurse position to an RN lead role within the clinic, and I'm really excited about it. As a lead, I'll still have opportunities to care for patients and assist with telephone triage at times, but I also have more responsibility. I'll get to act as a liaison between the staff and the administration because I essentially have my hand in both. I will do things like coordinating staff schedules, making sure that the appropriate resources are available. I'll act as a resource and support my team from day to day during any kind of operations. So if something comes up, I'm kind of their go-to person. I will be helping with onboarding new team members, interviewing potential hires, and the RN lead really plays a big role in process improvement. So I'm excited to develop new programs or enhance existing programs so we can make patient care even more effective. And in addition to having a career that makes a positive impact on others, nursing really brings other benefits too. So for starters, there's a high demand, meaning there will also be a high demand in the future, and there are lots of job opportunities available. gives you those choices of where you want to work and when you want to work. It's truly a trusted profession, and there's potential to earn what you want. You can pursue different specialties. So when you find something you love, you can really just dive into it. Schedules are generally pretty flexible. You could do full-time, part-time, first, second, third shift. You could work 12-hour shifts and work fewer days a week. Some people work 8-hour shifts. It really all depends on what works for you. And, then you can get that work-life balance in there, which is really important. Also, the uniform's really comfortable, customizable. You can really show off your personality. So just a little extra perk. There you have it. It's nursing in a nutshell. I hope you guys learned a little bit more about the nursing profession, and maybe someday some of you will walk down that road towards healthcare. So I appreciate your time, and I hope you all have a fantastic day. Thanks.
Allison, we have a question here at Lincoln High School. Just wondering if you talk a little bit about wages and how salary differs depending on roles you're in healthcare.
Sure. So there are different tiers for different types of positions. So working at the hospital typically makes more than working in a clinic. I think it was maybe $1 or $2 difference per hour. I think it's just the more acute care you work, the more you make, or the more risk that would come with your job, the more you make. So doing home health, you would make a little bit more than you would make in the clinic, probably similar to what you would make in a hospital. Does that kind of answer your question?
Yeah. Do any of the other high schools that are logged on today have any questions? If so, you can either unmute or put them in the chat and I can share those with Allison. While we're waiting to see if there are any other questions from other schools, do you have any advice to students who are right now thinking that maybe healthcare is a career they want to go into in the future?
I definitely encourage you to explore that. Look into your options. There are so many different things. I mean, registered nurse is not the only thing that you can do within healthcare. You could be an LPN, you could be a medical assistant or a nursing assistant. I do encourage you to try to get your toes wet if you are thinking about pursuing anything like nursing. Working as a nursing assistant while I was going through school was huge. It helped me so much with all my skills and just being comfortable working with patients. So it's kind of those gradual steps that really help build that foundation.
Last question I have for you. Favorite moment in your career so far?
Boy, I think the first time that I assisted in surgery doing a colectomy. So we had a patient who was seeing us for a colon cancer, and it was pretty early on in my RN first assist training, but the surgeon I was with had confidence in me, and he, encouraged me to assist him. So I was in there and I got to learn so much about the anatomy. I got to practice a lot of my different skills, like the retracting, just looking at what I needed to do and anticipating that next step in surgery. And then of course, stitching things closed was very fun because there was a lot to do.
That's awesome. Thanks, Allison. I'm not seeing any other questions in the chat from the other schools. So I just want to take the chance to say thank you so much for sharing your wisdom with us, and have a great rest of your day.
Thank you.